Hi, my name is Dr. Donna Ryan, and I'm Professor Emerita at the Pennington Biomedical Research Center in Baton Rouge, Louisiana. Welcome to this podcast episode, How Much Weight Should You Lose? This is part of a 6-episode podcast series called Finding the Weight Loss Plan for You. Today I'm speaking with my friend and colleague, Dr. Fatima Cody Stanford. Dr. Stanford, can you tell us a little bit about yourself?
Absolutely, Dr. Ryan. It's a delight to be here with you. I'm an obesity medicine physician and scientist, and what I do is I help people with their weight loss journey for patients between the ages of 2 and 90 to help them get to the happiest, healthiest weight for them.
So, Dr. Stanford, we're really going to be talking about how much weight you need to lose, but I want to set the stage first and give some background information to our audience. My first question for you is, what's the number one challenge that patients face in undertaking a weight loss effort?
Dr. Ryan, I think that's a great question. And, one of the key things challenge is that people think that obesity is just about eating too much and exercising too little. And we know it's so much more complicated than that. Obesity is a chronic, relapsing, remitting disease that affects people differently over the course of a lifetime. And it's a chronic inflammatory condition. And it's important to note that there's so many factors that cause obesity, things like stress, trauma, racism. All of these things increase inflammation, which increases the storage of fat tissue, unfortunately, in the area we don't like, which is right in our midsection. So it's important for us to recognize that our biology is playing a major role in how our body regulates weight, and different factors play a role. Our age, our gender, health conditions have huge impacts on our weight. And so when we talk about it just being about how much someone's eating and how much someone is exercising, that's really simplifying it and actually is just really wrong.
Dr. Stanford, how do you actually get patients to embark on their weight loss journey? It requires a lot of effort.
Yeah, it does. But I think when patients are ready to make that commitment to understanding how their body works and I can help them figure that out, then we can actually go on this journey together. And a lot of that really starts with helping them understand how their biology works and then asking them what their goals are.
Let's say you have a patient that says, I want to lose 50 pounds for my daughter's wedding. What do you say to her?
So I'm glad that you brought this up. I do often have people come in and tell me they want to lose weight for a wedding or a class reunion or, some other event. And I really help them reevaluate this. I look at weight and weight regulation as a long-term game. When we talk about short-term goals, there are immediate goals we can attain, but I don't want them to just lose it for an event. I want them to lose their weight and sustain that over the life course. And so I don't want them to just go on some type of fad diet or whatever it might be to lose weight and only to have it rebound. This is the kind of the thing that we call weight cycling. So what happens is particularly, on January 1st, when people start new plans, they lose weight acutely, meaning they lose it, pretty rapidly, and then they stop whatever that intervention and their body actually works to regain all of that weight and sometimes even a little more. So I would have this patient really think about this issue and whether or not this has happened in their lifetime. And for most people that have tried to lose weight, it has. And let's think about the long game, not just the short end game of getting to her daughter's wedding.
Now, going back to the original question, how much weight should you lose? Is there a perfect number for everyone?
So I would say the answer is no, there is not a perfect number for everyone. And the goal is to find the best weight for that individual. So I never give my patient a target weight or a target body mass index. All these things I think set us up for failure and a lot of stress. And as we talked about a little bit earlier, stress sets us up for storage of what? More fat. So why induce that level of pain for them? I really try to understand what their health status is, what type of strategy they're interested in. Is it going to be lifestyle modification? Is it going to be behavioral therapy? Is it going to be anti-obesity medicines or even metabolic and bariatric surgery or a combination of any of those? You have to recognize that if we're going to use medications, that there is a lifelong commitment to the use of these medications if they are effective. And often patients are a little surprised to hear that medications are used chronically. But remember, we're treating a chronic disease. Just like treating any other chronic disease, we would want to use these medications on a consistent basis. When I look at a particular intervention, I have the patient understand that on average, people will achieve X amount of weight loss. And by that, I mean, if we're looking at the use of behavioral modifications, we're hoping to get at least 5% total body weight loss from those interventions. But even then, that might not be what we achieve. From medications, we consider a medication to be effective if we're achieving between 5 to 10% total body weight loss, and with some of the newer medications, even higher percentages. And then with metabolic and bariatric surgery, we can be looking at 25% total body weight loss on average. So it really depends on the intervention, and using that intervention to help guide my conversation with them about what's considered average, and recognizing that, every person is going to have their own journey.
This percentage weight loss with different treatments, do you talk to patients about percentage, or do you translate that into pounds?
So let's say someone weighs 200 pounds, right? And they lose 10%, right? That would be 20 pounds. But if someone weighs 300 pounds, 10% would be 30 pounds. So I try to tailor it to the individual. So I'll talk about that percent, but then I will translate it to their weight and what that percentage would be for them individually, recognizing that, each of my patients come in at a different weight and weight status. I'm often even showing them their graphs on their screen of what their weight looks like over time and how it's responding to an intervention. And that really gives them a picture of how they're doing and really helps them understand their journey.
So, Dr. Stanford, what's the typical weight loss trajectory look like? What do you say to patients that are expecting to lose 10 pounds the first week and every week thereafter?
Well, I would tell them that the weight loss trajectory is often very steady and not quite that pronounced. Even in situations where people undergo surgical interventions, they may not lose 10 pounds in a week, and we know surgery to be potent or the strongest potential intervention that we can use. So I think people have to recognize that if we were to lose 10 pounds every week and every week thereafter, we would eventually get to zero, which is just not compatible with human life, right? We have to weigh something. So I think we have to think about this kind of steady weight loss that often occurs over time. A lot of people, compare themselves to other people, looking at what their friend or family member has lost with whatever intervention, and then compare themselves to that person. And I think we really need to make sure we don't do that. Each of us is individual. Our biology is different.
So what I'm hearing so far is that patients' goals should be beyond weight as a number. Is that correct?
Absolutely. And I think that this is an extremely important point, Dr. Ryan, is that this is more than just focusing and hyper-focusing on a particular number. When I am looking at a patient that comes in with excess weight, I want to go below the skin surface. And by that, I want to do some deep level investigation. I want to find out, do they have high cholesterol? Do they struggle with issues like type 2 diabetes or prediabetes? Do they have issues like polycystic ovarian syndrome? Do they have issues with infertility? Do they have issues with arthritis, etc.? These are things that are going to help me understand the complexity of their disease. As obesity and extra weight improves, often these obesity-related diseases improve, and that is what we're hoping to achieve. Sometimes these things can improve without significant change in the numbers. So they may say, hey, I've only lost X number of pounds, but guess what? My cholesterol is now normal. That is a big win. And I think we have to think about these things that help them understand the importance of not how they look in the mirror, but looking below the skin surface, looking to see what's going on inside of their body.
It's really about your health, not just about your weight.
Absolutely. This is a health journey. And so when I think about talking about weight, I'm talking about health. And it's important for us to recognize that at different weights, different people will have different health goals and achieve certain health goals. And so it's not about focusing on a specific number.
How should patients keep track of their progress in their weight loss journey?
The key things that I have my patients do at every visit is to take their weight just to get a sense of what they've lost. We've talked about that total body weight loss percentage. And then I also have them doing their waist circumference. And whether my patients are seeing me in person, where we would actually measure it for them, or via like a telemedicine visit, I have them tracking that. What we do know is that looking at one's waist circumference gives us information about where fat is being stored. And we want to keep their waist circumference for women below 35 inches and for men below 40 inches. I think the easiest place is just measuring at the belly button.
Now, what about the scale? Everybody has one at home. Is that reliable?
So I think the scale is something that's good to help us have a sense of how we compare to ourselves. So let's say we started off at 300 pounds and we're tracking ourselves, and next week we weigh 298 pounds, and then the next week 296 pounds. We're getting a sense of how our body is responding, but we're not hyper focusing on that number and being really tied into what that number says. Some people can continue to weigh less, but maybe achieving that weight loss in an unhealthy fashion. And so we want to do this in a healthy and sustainable way.
Dr. Stanford, you mentioned this earlier. How do you actually help your patients in their weight loss journey?
Absolutely. I think the key first thing that I say with my patients is to help them understand this is not their fault. For so many years, particularly for my older patients, they've been told that this is their fault. It's something that they're doing inherently wrong. And they begin to put a lot of that blame on themselves. And that really is something I want us to step away from. So I'm going to talk about a patient that I had, and this helped me to recognize how even us as physicians, Dr. Ryan, can be biased towards our patients. So this was a patient I've been taking care of in my internal medicine clinic for 3 years. She was a woman who was in her mid-40s that had severe obesity. And every single visit that she would come in, which would be about every 2 to 3 months, we would talk about her weight and we would talk about behavioral strategies with a focus on her diet and exercise, for example. Each visit, I may give her recommendations about, items she could purchase from the grocery store that will help her optimize her nutritional goals. And fast forward about 3 years, I happened to run into this patient at the grocery store. As I'm talking to her, I'm glancing at her grocery cart, and she says, "Dr. Stanford, see, I told you I've been doing everything that you've told me to do." And when you looked at her grocery cart, it was picture perfect. She had all of the wonderful things that we've talked about, those lean proteins, whole grains, fruits, vegetables. But despite this, her body had not responded with any degree of weight loss. And so it was at this point that I recognized just focusing on that as a strategy to help her, I was failing her as her physician. I needed to think more broadly about strategies that could be more helpful.
Dr. Fatima Cody Stanford, you sound like the ideal doctor for a patient looking for weight loss. But some doctors may not be trained and they may not be comfortable with managing weight. What should a patient do then?
This is a common issue, Dr. Ryan, where patients find that they are struggling with finding a physician that is able to understand them and help them on their weight journey. You might want to really focus on finding an obesity medicine physician, those that are actually board certified to care for patients with obesity.
Dr. Stanford, we've been talking about the goal for weight loss and reaching a happier, healthier weight. But what are some tips to stick to that goal?
And I think the first thing I really want to emphasize is that diet quality is indeed important. Like I mentioned a little bit earlier, we want to focus not necessarily just on like how many calories it is, but let's look at the quality of the food. So lean protein, whole grains, fruits and vegetables is really important. And one thing I think that a lot of us don't do well, myself included, is drinking plenty of water. Sometimes we think we're hungry when indeed we're actually thirsty. I think it's important for us to recognize that, different people may need to try different strategies at different times. Maybe you started this journey using lifestyle and behavioral therapy, and now it's time to graduate to using anti-obesity medication or even surgery. I don't want you to feel like you're a failure if you're using medication or surgery. And when we're looking at weight maintenance, it's extremely important to recognize that this is a long-term journey. We often have to amplify certain things. For example, with physical activity, we often need to actually increase that to maintain our weight. So studies have shown that somewhere between 225 minutes and 300 minutes a week of activity, moderate intensity, that means that during the activity, you could talk but not sing unless you're maybe Beyonce, is what you want to do in order to maintain your weight.
Okay, it's time for us to wrap up. Any last thoughts you want to share?
Absolutely. I want you to remember that this is not just about how much you eat and how much physical activity you get. It's so much more complex. We know that weight can go up and weight can go down. And those factors that are like related to development, genetics, environment, behavior, even age related changes, all of these playing a major role in how you store weight. So it's important for us to note these things and just recognize this isn't your fault.
And I'd like to add weight bias. Our society really has enormous bias against individuals with obesity, and unfortunately, it pervades our healthcare system. Patients feel judged about their weight. One thing that you brought out, Dr. Stanford, was that it's not the patient's fault, that there's a lot of biology that underlies obesity, and that obesity is a complex disease. Well, Dr. Stanford, thank you for this enlightening discussion today. And thanks to our listeners for joining us as well.